Welcome to SimplyRN. This video is for educational purposes only and not indicated for clinical use. Today we will be doing our Study Buddy series, in which I will be your study buddy, who will be asking you questions with pauses in between, and then I will provide you the answers. It's like an audio flashcard for your ears. Okay, let's begin. Today's topic is bacterial meningitis. What are the different types of meningitis can you think of? Different types of meningitis include viral, bacterial, fungal, parasitic, and non-infectious causes such as cancer. Of all the types of meningitis, which one is the most common? Viral meningitis is the most common. What about the most dangerous? The most dangerous is bacterial meningitis. Can you tell me why? What complications can it lead to? It can cause septicemia, which is an infection of the blood. What is meningococcal meningitis? Is it viral or bacterial? Meningococcal meningitis is the most common cause of bacterial meningitis. What isolation precaution do you need to place patients suspected to have meningococcal or bacterial meningitis on? They need to be placed on droplet precaution. How long do they need to be on droplet precaution for? Until after they have received 24 hours of antibiotics. I will repeat this again. The nursing priority for anyone suspected to have bacterial meningitis is to place them on droplet precautions and maintain that precaution until after they have been on antibiotics for 24 hours. That is a very common question on exams. What is the order of donning or putting on PPEs for droplet precaution? The correct order is to put a mask on first, followed by goggles, and then gloves. What about doffing or taking off the same PPEs? You would take off the gloves first, then goggles, and remove the mask last. True or false? All meningococcal cases need to be reported to the local and state Department of Public Health. That is true, since meningococcal meningitis is spread by droplets. Which population is at risk for getting the infection? Think of living situations. That's right. Crowded living situations such as dorms, prison, and homeless shelters are all risk factors. True or false? A college freshman can get vaccinated for viral meningitis before college? False. That is a trick question, because the only type of meningitis you can get vaccinated for is bacterial meningitis, and it is recommended as a booster vaccine at age 16 or before college starts. You are doing great. Let's do a few more questions. What is the golden test to diagnose meningitis? A sample of cerebrospinal fluid. How do you obtain a CSF sample from a patient? Via a lumbar puncture. Do you expect the glucose level in a CSF sample to be high or low for suspected bacterial meningitis? It would be low. What about viral meningitis? The glucose level in viral meningitis CSF sample would typically be normal. What about the protein level in a CSF sample for bacterial meningitis? It would be high. True or false? The WBC level in a CSF sample will be high for both bacterial and viral meningitis. That is true. They both will have high WBCs, but it will be significantly higher, like over 1,000 to 2,000 for bacterial meningitis. What are the 3 classic triad of symptoms of bacterial meningitis? That's right. Fever, neck stiffness, also called neutral rigidity, and photophobia. Your patient is lying supine on the back, and you flex their neck toward the chest. Are you trying to perform the Brudzinski test or the Kernig test? Brudzinski. What would happen if the test is positive? Yes, the patient would bend the knees and hips involuntarily due to pain. Your patient is laying flat with their knees bent. And what would you do next if you want to perform the Kernig test? You would attempt to straighten out their legs. What would happen if the test is positive? There would be resistance or pain with the knee extension. Your patient who is diagnosed with bacterial meningitis appears to be more restless. What are you concerned about? You should be concerned about increased cerebral pressure. Some early signs of ICP in adults include altered mental status, restlessness, and irritability. Name things that can increase ICP that we can control with nursing interventions. That's right. Making sure the head is not bent over. Keep head in midline with neutral neck position. Keep the head of the bed at 30 degrees, and avoid coughing, straining, or too much hip flexion. You did a great job at answering the questions. If you like to see more Study Buddy reviews, leave me a comment below.